Welcome to the next version or next episode of the Last Visit First podcast. Today I have a special guest with me, Mark Kimsey, who's the CEO of Mission Healthcare. Mark's been with Mission since 2009. He was one of the co-founders of the company. He's helped guide the organization through growth into multiple state provider while maintaining a strong focus of clinical excellence, culture, and patient-centered care. They service home health, hospice, palliative care, and transitional care services. Prior to becoming the CEO, Mark served as the president and chief operating officer. He is widely recognized as a thoughtful healthcare leader who is passionate about developing people. He's one of the best sales guys I've ever met. Today, we're going to discuss his leadership, growth, innovation, compliance, all the details around California. So start it off, Mark. Tell us about you and how'd you get into healthcare?
First of all, thank you for having me, Tom. You and I have been, how long have we known each other?
It's 2007,
5?
6? Back when you were at Care South? Yeah, 5 maybe, yeah.
Quite a long time. Always have been very helpful. We've shared resources over the years. Appreciate the friendship and the support that you offer Mission Healthcare today. So get to the question. I grew up in a healthcare family. My parents were in hospital management. And when I was 13 years old, there was a summer intern program at the hospital that I signed up for. And so I had a summer job at age 13 in the medical center of Central Georgia. And from day one was drawn to healthcare. Initially, I was in an administrative function, making copies, fetching turkey sandwiches and Diet Cokes, but really gravitated towards the patient care area. Got an opportunity one day to go work in ICU just to sort of observe. And I was hooked. There was a particular patient that had been in an MVA, and I just watched the care, heartfelt care that was provided by the clinical staff, the physicians, the nurses in that experience. And to be honest with you, over the course of a few hours, I knew I wanted to be involved in healthcare. I couldn't have articulated exactly what that would look like. Thinking that, I want to study and be a doctor, or be a nurse, or be in care delivery. I mean, that was really what sort of caught my eye the first time. It's funny how things change over the years, and the vision evolves as you go. So I finished out that summer, and I remember being so excited to come back that next summer. I wanted to be in the heart of all of it. I wanted to work in the emergency room that next summer. And so applied for that role. And this again was as a 14-year-old. And from then on, I was off to the races. I worked after school. I worked weekends. I worked summers, and did that really throughout college. Met, actually, this was my junior year. Yeah, it would have been junior year of college, through my mother and father. Met a gentleman who was running Care South. And through that Thanksgiving exchange, he offered me a job. In fact, I left school early to go take that job. And so this was back, call it 95, 96. And Tom, as you know very well, the industry was going through major changes. We had cost-based reimbursement. We were going through an interim stage, actually called the interim payment system, and ultimately to prospective payment. And so being in that role, I had this great experience of seeing that transition. As you recall, it had a huge impact on provider reimbursement, but it was a great time to sort of absorb what was going on. And backing up a little bit further, and something that made a really strong impression on me is, the ultimate roots of Care South were from a company named, I can't believe this, I just went blank, Health Master. And as you remember, two of the big fraud and abuse cases in the United States were Health Master and ABC Home Health, based in Savannah, Georgia. Those two events really helped shape the Balanced Budget Act of 1997. And so having, again, a front row seat for that activity that occurred again during cost-based reimbursement, how that impacted the industry, dramatically. I mean, I was luckier than smart. I was just in the right place at the right time and learned an awful lot. From there, after, again, the time at Care South right out of college was intended to be a 2-year internship, which is exactly what it was. I was actually on the phone one day and Jim Mills, who is the Mills family associated with Medline, called, and after a 5-minute conversation, he offered me a job. And so that's sort of how sales got into my DNA. I think that company probably taught me as much or more about what I do today than really any other experience. Have great respect for the Mills family, and that organization has just grown and grown and grown. But that's sort of how the intersection of healthcare and sales worked for me. I was at Medline for, almost 8 years. I bumped into Rick Griffin, the CEO of Care South, and he said, "We want you to come home. We know that we can do more relative to stronger community relationships, having a more professionalized sales force." And he asked me to come back, as he put it, come back home to Care South, which I did. And I think it was shortly after that. I mean, you would know better than I, but Care South was one of the first home care home base adopters, or at least one of the earlier home care home base adopters.
Yeah, I think it was 2006 when we came out and met with you guys. I remember that, hanging out at the Marriott in Augusta, Georgia.
That's right. I've spent a lot of time there. But again, sort of right place, right time. Care South was an organization that really kind of had a regional footprint at the time. And I got to work in sales, and we took it from a smaller regional company to, let's call it, a super regional. They even added some West Coast locations, but had the great experience of ultimately leading sales there, and just wonderful things to say about, my time at Care South. Eventually you kind of get the notion that, maybe we should go start our own organization. I'd met some people that ultimately were my business partners at Mission, actually, Amy Nelson, who I know you know well, and Jennifer Kimsey now, who is my wife. And we, after working at Care South for a period of years, decided that we wanted to start our own company, initially in the home health space. That was a company we purchased called Genesis Care, single location. To say this was a broken provider is an understatement. 70% denials, an owner who was essentially going bankrupt, had not paid employees in months, owned the building that the provider was in, and the building leaked. When it rained outside, it rained inside, and we were on the triplicate form medical records, the white, the yellow, and the pink. And when you get rain on top of those, you have quite a mess. I think back about that experience. Like, honestly, I don't think I could survive it today. But taking that very, very, very broken organization where everything was wrong, and then turning it into a high quality, highly compliant, fast growing provider, wow, what an experience. So yeah, I might have given you a longer answer there than you wanted, but no, that's how I got the mission.
Yeah, it's perfect. And why there? I mean, there's a rumor out there that you guys chose the farthest point away from Care South, and you went to San Diego, California. I don't know if that's a true rumor or not, but I think Amy told me that one time. I don't know if she was joking or serious.
I will not confirm or deny. I'm gonna say good things about my friends that were at Care South, and an important organization for me over the years. This is really what it boiled down to. There were 3 individuals that I wanted to go into business with: Carrie Paul, Amy Nelson, and at the time Jennifer Robinson. And they wouldn't move. They loved Southern California. That's where they wanted to be. We talked about, there was a provider in the Pacific Northwest. There was a provider in the Southeastern United States, but I had sort of been bitten by the California bug a little bit, really liked the weather. And enjoyed kind of the vibe of Southern California. And so that's where we hung a shingle originally in San Marcos. And it was just home health. We didn't add hospice for several years. But, once we finally got the organization cleaned up, our service was in demand. I mean, we took the approach. I have a background from a kind of a rural area, Macon, Georgia. Jen is from the mountains outside of San Francisco. We felt important that we cover patients in remote areas. Access to care was a big driving force for us. And so we operated that way. When referral sources would give us patients out in rural areas, we were finding ways to say yes and accepting those. And I think probably more than anything else that we did, that really put, Mission on the map in a pretty competitive landscape in Southern California and contributed to some significant growth.
Tell us about the business today. How big is it? Where's it at?
Business has got 34 locations. We're 22 home health locations, 12 hospice locations. Just recently completed an acquisition, part of the Traditions deal. We got Portland, Salem, Bakersfield markets that we're very excited about. We're doing a traditional startup in Carson City and East Bay in the Bay Area. And so we're very excited about, the growth opportunities that the organization has over the next, several quarters. And, look, we love a challenge. We love growth that's exciting. We love the recruiting part of that. The aim in all of those markets to go out and find the best people we can that think like we think, that have a passion for what we do on a daily basis, that are, high trust and good work ethic. Amy always likes to say, and you've heard her say this, work hard, play hard. That's what we like to do. We've got to make work fun. I don't know if it's attention deficit disorder or whatever, but if it's not fun, and I don't like doing it. And so
That's right.
That's sort of our secret sauce.
It's awesome. And so I got to step on the Jen's your wife. You work with her every day. Jen's my wife. I work with her every day. Bless you. I mean, those are real big challenges.
They can be. Well, there are times we have our struggles. I mean, we do the best we can not to take work home. We do the best that we can to, separate projects, not step on each other's toes, really enjoy autonomy in the things that she and I both do. The good news is Jen's a clinician. I'm a sales guy. Amy is an angry bird. I'm not sure what she is. She's a tornado. So
she's an operations tornado for sure.
She is. So I think the best way to operate when you have close relationships, Amy and I are best friends, and Jen and I are obviously married. The way you make that work is you respect one another. You try to do separate projects. Like we have found some of the hardest things if we try to work together on something, and then, she has an opinion, I have an opinion. And honestly, that was one of the dynamics of Mission always. People were worried when Jen and I got together, are we going to, block vote and ram our agenda down everybody's throat? It's actually the opposite. Jen and I were always the two that, sort of butted heads over different direction. But that's good. I mean, we found that to be very healthy for the organization over the years. You're not wrong. Not without its challenges at times. You've got to leave it at work. Sometimes that's hard to do.
Yeah, I worked with Mark and Anthony for many, many years, and they worked for each other. And Mark worked for me in April, and it's hard. It's people don't realize it. And then our kids work with us too, and so Christmas, Thanksgiving, dinner, we're always talking home health or hospice. You're like, all right, everybody put their phones down. We're not talking about anything healthcare. Let's talk sports or the Knicks or the Spurs or whoever. But it's tough, and you guys have worked really well together. And then Amy, I mean, is a good friend. Carrie Paul, I know, is a good friend of y'all's too. And so that's always a challenge, right? When you work with your friends, but it's what makes it work. I mean, we spend more time at work than we do at home, right? You spend more time at the office, so you might as well spend time with people you're like.
You said that, you couldn't have said that better. I think that's absolutely been a key to our success, is we enjoy working together.
And you're both the same mission, working on the same things, similar things, not necessarily. It's cool that she's a clinician and you're not. I mean, Jen and I are both, we tried to do the co-CEO thing forever and it was terrible. I mean, it was, they'd come ask mommy and come ask daddy and I'd say yes. And she'd be like, I told them no on that. And what are you doing? And I'd step on her in a conference or in a meeting or something and say, no, that's not how we're going to do that. And have an opinion. And then, you know, you don't talk to each other for 2 weeks and it's tough, but you guys have always worked well together in my eyes. And I mean, I've known you both for many, many, many years. So, all right, what's the most challenging part about being a hospice and a home health in California right now?
Well, as you know well, there is a lot of fraud, waste, and abuse cleanup activity that is going on out here. Somehow Los Angeles County ended up with about 1,600 hospice providers. We saw that happening when in the early days of Mission, and, you hear anecdotal stories about, pay for referrals and things like that. And so really what most providers did is they just avoided those areas. We certainly did that. We stepped over, that environment. And as it turns out, I mean, I think there has been criminal activity in that county. You hear stories about, owners of provider numbers that bill and bill and bill and bill. And then when finally they're caught, they just launch another provider number and bill and bill and bill and bill and bill. And I mean, I will tell you, on one hand, we're thrilled with the cleanup activity. It's long overdue. Some of the questions that, probably should be asked is, how did we get here? How did we certify 60? LA's a big county, big population, but all accounts are, it ought to have 200 providers, maybe. So we've got eight times that. How did that happen? How did they get through certification? How did, the background checks that you're required to go through to have a PTAN and get CMS approval and California state licensure? How did that happen? Because I think it's something that we've got to avoid moving forward. There is negative fallout associated with this. Good providers are having to carry the burden of enhanced scrutiny, of something called PPEO, Provisional Period of Enhanced Oversight. It might be the most aggressive sort of audit cycle that I've ever seen in my 30 years in the space. We understand the intent. The intent is to weed out unscrupulous operators. I think it's certainly doing that, but we hear a steady stream of stories that good, highly compliant providers are also being taken out of business. And so you don't want to hear that. I believe that we'll dial in eventually sort of the right balance. I think aggressive steps absolutely did have to be taken, but California is, as of today, a very challenging operating environment because of some of those activities.
Yeah, I think also reputationally in the news, it's tough too, right? I mean, let's call it, most people that are patients that are, on your service watch the news. They watch the national news 4 or 5 hours a day, and hospice is all over the news, and home health's all over the news. And so that's, to me, is very limiting and unfortunate, because it's given, they don't talk about just the bad fraudulent actors. They talk about hospice or home health as an industry, and CMS and Oz is out there and he's talking. And so the good providers that are compliant, that are using the right tools, that have all the right, puzzles, doing the right IDGs, doing the right, case conferences, all that, are getting mixed up and getting the reputation, kind of tarnished, if you want to use that term. And so physicians have to worry about, who do I send my patients to? And so if you're a good, clean provider, hopefully you can convince the doctor that you're the reason why they need to send the patients to you, because you're going to take care of them and do the right thing. It's really sad, though. It's not just in California. It's in Texas and Ohio. They closed 49 in Ohio last week. Minnesota's full of it. It's all over the country now.
We've taken the approach that, as the largest West Coast provider, we really need to be educating physicians, patients, family members. How do you identify a compliant provider? And of course, there are ways to do that. I mean, you can look at Medicare Compare, and you can look at, census numbers. I mean, traditionally, a lot of the smaller providers and ones that have been in business not very long are ones that you have to be careful about. But we're actually working on a marketing piece right now that talks about concentrations of visits at end of life, major key indicator. We tell people, if you're local, drop by the office. You'll see that we're a legitimate provider. You'll see the activity. We have gotten a flood of questions lately. I want to know who my clinician is. I want to know who the aide is going to be. I want to know what their backgrounds are. People are definitely on edge, but because you're right, it is a steady part of the news cycle right now.
It's unfortunate, but yeah, you're right. Talk to me a little bit about some of the technologies you guys are using out there. So I know you're on Home Care Home Base, you have Muse, you have some of the Medalogix products. You guys use SHP. You've pretty much adopted an advanced technology as probably as far as you can.
We love it. I mean, in fact, I even reverting back to the discussion about being a compliant provider. I mean, we can take and share data out of Muse that shows that we're monitoring care to appropriate patients at a level really, if you don't have those tools, you can't do. I've got a meeting tomorrow with the largest Medi-Cal provider in Riverside County, and the centerpiece of our presentation is going to be Muse data to show that if you send us a patient, we're going to monitor that patient. We're going to make sure if their condition changes and they don't qualify for hospice, we're going to discharge them. We can track patients and their acuity. We know when we need to increase visit loads based on that data. So, I mean, these tools really well, Tom, but I mean, I'm telling you, they are giving us powerful insights that give us an advantage over the competition that is very unique.
Yeah. And how else are you guys using AI inside the business? Have you started with Scribe or any of that kind of stuff yet, or where are you at with that?
We have not done Scribe. I think that's absolutely probably next on our list. I think that's something that we need to implement. You've got to get on the AI train. You can't bury your head in the sand. You've got to embrace those tools. If you don't, you're going to get left behind.
Yeah. All right, Mark, I want to get into some of your recruiting skills. You're one of the best recruiters I've ever met, and you build these relationships with people. And I've talked to salespeople that actually met you personally, and they're like, holy cow, I want to work for Mark. What's the secret sauce there? I know you've learned it from somebody. I don't know if it was your dad or Rick Griffin or who, but what's the secret sauce there?
Yeah, it was my father. He knew how to connect with people, and it was real. It's really having real connection and listening to challenges that people have, goals that people have, and then delivering that. I was watching a podcast last night that Steve Jobs did many, many, many years ago. And he said, really, if you're the CEO, you work for your best people, not the other way around. You go out and recruit great people, and your job is to remove their obstacles and support them, not the other way around. So my father understood that. And, he also was a walk around manager. I mean, he would be in physical locations. He didn't work from the corporate office. He was always out in the field, always listening to what his people had to say. And once you make that kind of a part of your organizational culture, that we're here to support you, we want to know your feedback. We believe in careers, not jobs. And I think there's a significant distinction there. I mean, our jobs as leaders is to show people that you come on board with Mission Healthcare, you can retire here. We're a large enough organization that really wherever you want your professional career to go, we can give you those. We can give you the support to get there, over time. So, there are other I mean, you got to have robust benefits. You've got to be competitive relative to, compensation and things like that. But really, when you start talking to people on the level of what do you want to be doing in 2 years, 3 years, 5 years, 10 years, I had a conversation like that. Gosh, first thing this morning, there's a connection that creates. And you have to make it real. I mean, your job every day is to, think about who's on your team, think about what their challenges are, think about what kind of communication do I need to give them so that they're ready to take that next step. Nothing gives me greater satisfaction than watching people be promoted up through the organization, rise to those challenges. Some of the folks that started with us in entry-level jobs are running divisions today at Mission, which it's just, I think it's just really good for culture.
Yeah, and for the listeners that don't understand it, California is a non-compete state. They don't have a non-compete. So you can leave in your job and go down the street and work for someone else. And so, I mean, you don't have the luxury of in other states where you can say, hey, you sign a non-compete, you can't go work for your competitor. In California, that doesn't exist. So you got to build a culture where people want to stay, they want to hang out. That you can't threaten them with legalities because there's no legalities in California. And
You're
so
exactly right.
It's an area where if you can get people to stick around, I always tell a story. There's a place in St. Paul, Minnesota, and Heath Bartness took me to dinner there one night, and we're talking to Big John behind the bar. And Big John's been behind the bar for 50 years. He's worked behind that bar for 50 years. And I stopped him and I'm like, Big John, what is going on here? You've been a bartender for 50 years. Never been promoted, never different job. He's like, they take great care of me. We have great culture. I love my clientele. And he's like, and I'm not even the most senior person here. The guy that cuts your steaks up back in the back has been here longer than I have. And I'm like, holy cow, what are they doing right at, it's called the St. Elmo Grill. What are you doing right at St. Elmo Grill to get people that want to do that job for 50 years? It's pretty amazing though. And it's kind of what you're doing. Like you got people that work for you for a long, long time that have been in, QA or in your department that started out in the beginning. I remember talking to one of the ladies that was kind of a VP of sales, started out as a scheduling coordinator. And I mean, now she's running sales. And there's a lot of those kind of stories. And so you're doing something right there, Mark, because getting people to stick around for that long is pretty amazing.
I think we've been fortunate. I mean, I will never name names, but you have some experiences over the years where those are not the cultural ideals of an organization. And you see the damage it can do if you don't value people and their day-to-day experience. I think that is something that we got right, when we founded Mission. And, again, I think it gives us joy to see people, be promoted up through the organization and enjoy where they are. I mean, I don't have one near me, but my favorite award to get is the San Diego Union Tribune Employer of the Year, voted on by your staff. And we won it something like 5 years in a row. Nothing makes me happier.
It's awesome. All right. What's next for Mission? What are you doing? De novos is kind of out of the strategy right now because of the government's moratorium on that. But where do you see? Are you diving deep into your communities and trying to grow the branches? Are you going to do acquisitions? Where are you at?
It could be all of the above. I mean, right now with all of the de novos that we sort of have planned, a big part of the next 4 months for us will be investing in the growth of those organizations, going out and recruiting the best people in those markets, supporting that growth, staging it appropriately, of course. So, this will be a year of refinement. We still evaluate everything that we do on a regular basis, but I think when you do acquisitions, it is so easy to neglect the cultural integration of those people, especially when they're 1,000 miles away. And we have branches now up in the Pacific Northwest. And so my time is going to be spent on the ground in those branches, getting to know that staff, supporting them, understanding what their challenges are, and making sure they understand really what Mission as an organization is about. So, for the next, call it 9 to 12 months, it'll be focusing on those new markets, supporting what we're already doing. We've got a lot of markets that are in growth mode, that have good quality scores, good leadership. We just want to leverage that and spread that to these newly certified branches.
It's awesome. It's awesome.
HCHB is proud to sponsor the Last Visit First podcast, which explores the complex issues faced by today's home health and hospice providers.
In the spotlight today, Chief Revenue Officer Hannah Pearson, explaining how HCHB uses technology to connect people.
One of my favorite phrases is relationship architect. The focus is about the client and building the right community, the right fabric of community around our customers, making sure that from the very bottom to the very top, they had a resource and a contact to reach out to with any problems, and that we could connect them quickly and expeditiously to the right resource. That's where the client success team was born, and we touch people at every level of the organization.
In home health and hospice, growth isn't just about closing deals, it's about execution. I'm Jay Duty, Chief Operating Officer at Maxwell Tech. We work with operators and investors navigating mergers, acquisitions, and rapid growth. And we consistently see the same challenge. The deal closes, but the organization struggles to perform the way it had. That's where Maxwell Tech delivers. We specialize in post-acute M&A optimization, standardizing clinical and operational forms, redesigning care pathways, aligning workflows across disciplines, and leading enterprise implementations from planning to execution. Our consulting is focused on throughput, productivity, compliance, and technology adoption. So organizations don't just integrate on paper, they operate as one scalable platform. This is not slide deck consulting, it's operational execution. We help organizations reduce documentation variation, improve their throughput, and ensure clinical, operational, and technology strategies are all aligned, especially in today's environment of reimbursement pressure and regulatory scrutiny. If you're integrating, scaling, or preparing for your next phase of growth, we'd welcome a conversation. Visit maxwelltech.com or email sales@maxwelltech.com. From first touch to last visit, this is how organizations scale with confidence.
Also like to thank our sponsor, IntelliTriage. IntelliTriage is a human in the loop, nurse first triage company that simplifies the triage function inside the home health and hospice community. You can reach them at IntelliTriage.com. What roles are you most excited about to recruit for in the next 2 years? So if I was looking for a job and I'm listening to this podcast and Mark's hiring, what are the roles that you're really looking for?
Technology's got to be a big one. I mean, we, with all the changes associated with AI, I think that's a role that we would be very excited to pursue, one that we do not have today. I think that, again, associated with the climate, not just in California, as you mentioned, but in terms of hospice and regulatory scrutiny that is, kind of at a heightened state. I think we can always augment what we do relative to compliance and accurate charting. And, again, in the Pacific Northwest area, we've identified, some really seasoned, strong regional leadership that we're already onboarding. So we're excited about that. But, as an organization that has 1,500, almost 2,000 employees, there are very few roles that we don't have that are available. We are constantly in hiring mode, so really anybody in the markets that we serve, we have something in one capacity or another. When you consider you've got an administrative organization, you've got a clinical organization, you've got a sales organization, you've got IT function, you need clinical experts. I mean, Tom, we'll take them all.
All right, let's do a little plug for you. They want to get a hold of you and sign up for a job. How do they do it?
Homewithmission.com. Easy to remember. You'll certainly be able to see a lot of posted positions. It changes so often. It updates typically about every 48 hours. That is the easiest way. I would not be too embarrassed to give my personal cell phone number, but start with the website and we'll go from there.
Yeah, when they apply for that job, they're going to get right to Lindsay and her team, and she's going to put on the recruiting hat and figure out how to, make sure you get in the right position in the right spot. All right, you start talking about these leaders you're hiring up in the Pacific Northwest. I know you're hiring leaders everywhere. I see all your postings out there. What makes a great leader at Mission? What are the traits that you're really looking for?
Number one is going to be understanding that supporting your staff is your number one job. We don't like big egos. We like folks that recognize that being a servant leader is the successful way to do it with the services that we provide. So I think that's first and foremost. the obsession about the people that work for you and their daily experience, being fixated on removing their obstacles. We like people that have a passion for it. I mean, during interview processes, you can tell people that are getting excited when they hear about our culture. And those that get excited when they hear about it typically, really make great fits. Nobody bats 1,000, but, we generally, for most key roles, in fact, most roles, period, we do panel interviews and have a lot of different people in the organization have exchanges. But cultural fit is really big. Don't even need to say trust. I mean, that's sort of first and foremost. But folks that recognize, one thing that's going to make Mission different is the employee experience. As leaders, we've got to be obsessed with that.
So I agree with that, Mark. And then knowing you and Jen and Amy and Adrian, hustle's the other one. And it's the trait that I see in you guys a lot is that this team hustles and they get out and they do the work and they put in the time. And you're living in California, you have a house in Georgia. I mean, you're hustling right now. You're committed all to it. And I think it's pretty amazing.
Burning calories, losing a little weight. We don't mind hustling.
It's awesome. I love watching it. I mean, you guys are really hustling and that's great. It's a trait that's hard to get out of an interview though. I mean, everybody will talk about how good they hustle, but really once you get them on board and see it, I mean, it's something that we look at all the time is if you don't have hustle, I can't teach that. I mean, I can push you, but I can't teach you to hustle. You got to want it, right? Yeah. You got to want it and you got to get it. You got to go get it.
And we tend to find that if they don't have that, we both, the employee and we agree pretty quickly, this is not the place for them. And we say in interviews, if your goal is to get a job and sort of hide and, function in the shadows and work at 50%, this is not the spot for you. That is not our culture here. We do hustle. We expect others to do that. But we also play hard. It's rare that a day goes by here without, somebody pulling out a big super soaker squirt gun and running through the intake department. And we encourage that type of activity.
Yeah, it's fun. I mean, yeah, you want to have fun. I mean, again, you spend more time at work than you do at home. So why not have fun while you're doing it? All right, let's jump into some more of the passion stuff. Tell me about a story. And I know you have a bunch of these as the CEO that you've heard about. Tell me about that one patient or that one family that wrote you a letter or called you or you talked to that really made a difference in who you are and what you do.
There's a lot of those. I'll spare the name, but in Southern California, there are a lot of Hollywood personalities, famous people, whatever your bar for that is, but had a well-known individual send us a letter that talked about his mother, his father, his aunt, that all passed on our service, Mission Hospice, and the profound impact that it had on their final days. I mean, the best letters you get are the ones that say, we feel like hospice in this case extended mom's life because she was so well taken care of for weeks and months. And these were the things that as a family we were able to do because of that support. These are the most trying experiences of people's lives. They're scared. And, if we do hospice right, and I think that highlights the fact that we got to get it right, you can make a really, profound impact. But this letter in particular that I recall was written with 3 family members over the span of about 2.5 years that had passed with us. And, this individual said, I want to know what I can do to get involved. I want to know, can I, support you with a donation? I want to be a poster child for this organization. So you can tell it really does move people. My family went through an experience, and this was East Coast. It was family, but my wife's mother passed just this last year. It's amazing the kind of impact that good hospice service can have on not just patient, but family, extended family, friends, by making that process smooth.
It's really cool. I'll tell you a story about your organization too. So there's a book right here. I don't know if you know the story of this book. I can't point to it right here. That's Nana upstairs, Nana downstairs. There's a lady on your team named Sarah, who runs she's one of your bereavement coordinators. And she got this book. And one day she called me and said, I need your address. I'm like, what do you need my address for? It's weird. She's like, I'm going to send you a present. And she sent me this book, and it's a kid's book. And it's Nana upstairs, Nana downstairs. Just so happened the book, Little Tommy, which that's what my family calls me because my dad's older. I'm younger, not because I'm bigger or he's bigger. But little Tommy's taken care of. He lives in a home, and great grandma lives upstairs and grandma lives downstairs. And it's Nana upstairs, Nana downstairs. And Nana upstairs passes away and goes to heaven. And little Tommy sees a shooting star and says, I think I just saw Nana wave at me. And it was really cool. And so we built a product called Bereave you guys are using. And Sarah knew I'd spent a lot of time with Sarah on it, and she knew that. And so she called me one day and she's like, I'm going to send you that book. So it's in every podcast that we do now. But it was amazing. I sent it to mine, and I called Nana. You know, we always talk about Nana. I had a Nana that died on hospice with Encompass Home Health under April's watch. And it was an amazing experience. That's how we created Muse. But sitting here one day, Sarah calls me and says, I need your address. What do you need my address for? And then she sent me that book. Of course, I sent one to my mom, and she lost her mind, started crying and carrying on. But it's one of the best children's books written. And it's always going to be there because it's that passionate. And Sarah was very anti-automation of bereavement. I mean, like, no, we're not doing that. It'll never work. And then we had an experience where the patient, she says we may have prevented a suicide because the guy's spouse was said some really mean things right before she passed away. And Sarah jumped on board with it. And she's the best advocate we have. But for her to send me that book was like amazing. Like I opened it up and like tears in my eyes, and I don't really cry. I'm a pretty tough guy. It's pretty amazing. So
that's a fantastic.
Cool.
I never knew that. Thank you for sharing that. That's super cool.
This is like 6 weeks ago. Like it happened.
Oh, I didn't know that.
So yeah. She just called me up one day and said, I found a book for you. I want you to have it. And I thought it was like going to be like a self-help book, like how to, quit being fat or something like that. No, it was a really cool book. It was awesome. Thanks for sharing this story. You own Family Home Health and Hospice in Georgia too. So you're in this hospice business deep. How's that going? I know you got Charlie out there and you have a couple of partners out there. Tell me about that one.
So, right, partnered with Jack Drawn, who I believe you know well. And
Very well.
Jack and I have been childhood friends, probably since we were 5 or 6 years old. And Jack had started Sacred Journey, and he sold similar to the time that Mission and Vistria partnered. And, he is has just really been enjoying his family. And so we'd started family, 2022. So we're going just over 3 years now. Jack got involved in year 2. We're up to 18 locations. The census has grown, really fast. Quality looks great. Charlie Hall and Jeff Nickel have just done a great job with it, which allowed me to get plugged back into to Mission Big Blue. I literally, we have a 1-hour call once a week that I don't even have time to get on anymore. And so those guys have just taken and run with it. I got an update from Jack this morning driving into the office, and so that organization is really thriving, which is great to see.
That's great. That's really cool. I mean, there's some magic there, right? Again, I go back to you hire the right talent, get out of their way. I mean, that's what Steve Jobs said. Hire the smart people, move all the obstacles and get out of their way and let them run. And it looks like it's happening. So, all right. So question, did you get Jack into hospice and home health, or did he get you into hospice and home health? I didn't know you guys were childhood friends.
So Jack, he worked at our Capita, and they were looking at the healthcare sector. I was, at this point, had been working for Medline, lived in Atlanta. Trying to think what year this would have been. So 6, 8. I mean, we're talking right around 2000. And Jack called me and said, look, I'm going to take you to a really nice dinner, but you got to explain to me how home health reimbursement works. And so I think he took me to the dining room at the Ritz, which we had no business being in at age 24, 25, whatever we were. But he had a corporate Amex. And so he bought me dinner and literally like on a napkin kind of sketched it out. Jack is super smart. He picked that up and ends up going back to our capita. And they end up doing at the time one of the largest deals in the home health space. I mean, really and truly it was. And I forget the name of the company, but they sold it to a medicine.
Wasn't it Halcyon? It was Halcyon.
It was not Halcyon. So that was second stage for Jack, but Jack was involved in Halcyon as well. This was prior to that. Wes Perry was the name of the CEO that ran the company, just escaping me, based in Long Island, New York. It'll come to me in a minute. But anyway, so I guess you could say the answer is yes. I did get Jack into the industry, but he, was doing really well in private equity, but decided he wanted to get into the actual business as an operator. And he did that. Big move, give him a lot of credit for it. He and Dan Cole did Halcyon. Ron Malone, Uncle Ron was on their board. And, they had a successful entry and exit there. And then Jack bought on his own, Sacred Journey, small provider, South Atlanta, and he grew it to, a very sizable, regional provider in a very short period of time. He was just super successful. He sees the world the same way you and I do, and likes to take care of his people. And he absolutely did that. And I would have told you he was probably done for good, but he had a little FOMO when we started family, and I was thrilled to get him on board. Jack's as honest as the day is long, hardworking. It's been great to partner with him, and he's given me a free path for the last 7-8 months to be here, which I am going to be eternally grateful.
Yeah, he's a great guy. He really is. He's somebody I've known for years. I've been to every Home Care 100, and I don't know how many of them we spent together with Jack and Ron and the gang, and it's just been a great guy, great fun time. He's a good dude. So
Jack,
I didn't know you guys were childhood friends.
We are, yeah.
Right.
Jack doesn't miss the cocktail party, so he'll be at Home Care 100 just about every year.
Yeah, he's there. Yeah, for sure. Yeah, him and his wife. His wife's an angel too, for sure.
She is, Liz. She's great.
Yeah, well, talk to us a little bit about the leadership team at Mission, and then we'll wrap up here. So, any secret sauce there? I know you got Amy, you got Steve, you got Amy Henrik, Jennifer. You got an amazing leadership team there, and you're getting all these things all these puzzle pieces are lining up perfectly for you. So, anything you want to talk about those people?
Yeah, I mean, this is hot off the press. I think you're aware as one of our board members, but Jason Gerard from Agape has just joined us. He's been on the ground for about a week. Jason's a superstar. He is our president and CFO. Thrilled with his energy. He's already made a very positive contribution. We also were fortunate enough to lure Angela Collins, spent a lot of her time at Bristol as one of their core operators. She actually managed 40 divisions for Bristol. She's a superstar, just fantastic to get her on board. She's already sinking her teeth into, what we can do to improve our hospice organization. So those are new hires, like in the last week. So lot of activity there. Lindsay Data, who you know well, my nickname for her is Sissy. It feels like a family member that, I've known for 30 years, super hardworking, just absolutely fantastic. And then, Amy and Jen, I don't need to tell you about those two. They're, we've worked together now for, over half my life, and it's been super. Taylor, she's supporting us all, keeping us straight. She's been, a great help. I will tell you, and then Barry Ausler, who has really just he's come in sort of a transformational role where he's working in a bunch of different departments. Barry has got tons of personality. He's probably made the folks at Metalogics, go a little crazy. He's always, trying to save a penny here, save a penny there. But Barry's absolutely a keeper, going to be a key leader here in perpetuity. kind of going around the room, making sure I don't miss anybody. But I mean, to your point, I look at this leadership team at Mission today. Gosh, I'd put them up against anybody in the country. I mean, it is a great group. It is a motivated group. It is a group that is having a ton of fun. I just think that, sky's the limit, as we move forward. Liz Pearson, I've got to mention Liz. Liz has been um, a stalwart of fraud and abuse and regulatory over the years. She had a law practice and has worked with, hundreds and hundreds and hundreds, if not thousands of providers across the nation. She joined us recently full-time as our compliance officer. Liz has a wealth of knowledge, can get anybody on the phone that she needs to, just super happy to have her. I could go on and on and on. I mean, this is, no knock on any place I've ever been. This is as strong of a team as I've worked with. Warren Smith in home health has had some incredible improvements in our home health operation. He's had just a great several quarters. I couldn't be more excited. I'm giddy about the team that we've assembled here.
It's awesome, Mark. That's really good. I'm super excited for you too. And you want to surround yourself with people that you want to work with, that you want to hang out with, that you want to, get things done with. And that's super important. And I know you've worked hard to get this team right where you want them. So congratulations to you and Jen and Amy and Carrie and the whole gang. What question haven't I asked you that we should ask you?
Gosh, that's tough. I don't know. I mean, I have to admit, I've loved this. Even when it's challenging, I like it. I like the challenge of fixing things and improving it. I mean, we get the chance to touch people's lives, both the employees that are here, the patient, their families. I mean, I just feel really lucky to have found this space. This environment partnered with Vistria. I can't tell you how much support David and Ron and Blake and Kip and you, Sherilyn Deary, Ralph. I mean, the support we have here is unparalleled. There's not a question that we can't get answered with our board and all the resources that go with it. I mean, we just feel really lucky to be, right place at the right time. And it's great to see this brand really rise again. See its, reputation in the markets that we're in just improve. Feels like day over day. So, I mean, we've got challenges in front of us, but we are having a great time doing it.
It's awesome. Well, thank you for doing that. Thank you for being on the show. You're a heck of a guy. I appreciate all you're working on, and super excited to see where you are this time next year when we redo the podcast for season 3.
That's great. Tom, thanks for all your support over the years. Can't thank you enough, sir.
All right, dude. Appreciate you. Thanks for being here.
Thank you, sir.